In January 2020, a coronavirus outbreak happened in Wuhan, China, with over 90,000 people infected. After 2 months of effort, China has contained the virus perfectly. As of contrast, the spread of the coronavirus in the US has never stopped.
We have it very much under control in this country. We had 12 at one point, and now they've gotten very much better.
It's going to disappear. One day, it's like a miracle. It will disappear. Looks like by April, in theory, when it gets a little warmer, it miraculously goes away. I hope that's true.
The Trump administration never intended to contain the virus. Trump even encouraged people to go out and social interact instead of social distance. The curve kept going higher and higher. A big hatred started in the US society toward Asian Americans. One of the data we collected about the infection of coronavirus in different races shows a tremendous difference between different races. Asians are obviously the best in fighting against the coronavirus. Lowest case rate compared to white people. Unfortunately, all of those races have a higher hospitalization rate and also death rate compared to white people. This means that white people have a tremendous advantage in receiving medicines and treatments. Coronavirus reflects the gap between the rich and the poor. A big percentage of minorities don't have much savings. If the government can't contribute them or reduce the cost of medicines, most of the minorities can't afford health insurance and their bill, so they pay a big amount of money for their bill. To protect the rights and welfare of minorities in the US, the government should provide cheaper medical insurance and basic living materials for minorities. Here we can see the data of vaccine distribution among minorities. Over 82 million doses have been distributed to all minorities, but only 65 million doses are administered, which means there's still a big portion of the population need to be covered. Then, let's watch a short interview about what Fauci says about the vaccine.
Hard things about the pandemic is that serious, well-meaning people get stuff wrong sometimes. In the initial months, you made some statements about masks, for example, or asymptomatic spread that you later revised as you learn more. I'm just wondering, does that humble you?
It's sometimes humbling because you have to make a decision based on incomplete data. If you had all the correct data at any given time, it would be very difficult to make a wrong or stupid decision when you have all the information in front of you.
You look like you're 60, but you turned 80 in December. And I'm wondering, did you worry at any point that this virus might get you?
Yeah, I think you'd have to be oblivious not to consider the fact that if you get infected, that you are already in a category of someone who has a high risk of having a serious outcome. I didn't fixate on that, but it was in the back of my mind because I had to be out there. Particularly when I was going to the White House every day, when the White House was sort of a super spreader location. That made me a little bit nervous.
Hello, Guan Yu.
Hello.
You know that the coronavirus has been a serious disease around the world now. What do you think about it?
Well, since it's a world pandemic, people, you and me need to take care of ourselves. So, 忘了我要说啥。
Bro, really? 没事，从一开始你不要动电脑，不要动电脑。先想一下。
I don't mean to. 等一下，
没事，先给你想一下那个。
它是对世界的一个。
你不要动电脑，别一会儿又出来那个消不掉了，你就反正等着就行，随时可以接着录嘛。
这是一个世界性的问题，然后你跟我需要这个 take care of ourselves.
Yeah, but if you take a look at the number one country, it's actually US. That's it. 就停就行了。
我准备好了。
Hi, Guan Yu.
Hello.
You know that the coronavirus has been a serious disease around the world right now. What do you think about it?
Well, since it's a world pandemic, people like you and me need to take care of ourselves. But if we take a look of the list, we can notice that the US is the top of the list to get the coronavirus.
So you mentioned the U.S. They're number one in infected cases. So what do you think the life of the minorities there, the coronavirus has infected?
Well, I do believe that the minorities are having a harsh life than others, because they're getting like less salary than other Americans. So they do not have enough money to pay for the medical care and stuff like that. So what do you think the people like you and me supposed to do for them to make their life better?
I think that's a great question, Pengyu, but I don't think you and me nor the American, not only us, can do something, but also the U.S. government. I think they should take the responsibility for minorities' life care, And as you mentioned, they have a huge medical bill to pay if they get infected. So maybe like the government should pay their medical bill. That relieve a lot of stress for the minorities, so they don't have to pay it, and also provide them basic life care, social welfare, like money. You use money for food, any bills, housing, etc. That's very important. Do you think the vaccine should be the solution to end this pandemic? What do you think about the vaccine here in the U.S.?
Well, I do believe that the vaccine is the solution for the pandemic, but not, but vaccine is one point. But I do believe that people need to care of themselves. That's the big part of the solution. Like wear masks when you get outside and keep distance between others. Yeah.
Yes.
But I also have a serious question about vaccine. What do you think? What do you think like the vaccine should give to people, and what kind of people should get the vaccine first?
Oh, okay. That's a very thoughtful question. Well, I think the first kind of group of people that we should get the vaccine are the hospital workers. They're the frontline warriors that fighting the virus. So if they get the vaccine, they can, fight more confidently with more barrier, and that barrier is our vaccine. And the second group of people are the children, the elders, then the young one, like young people, middle-aged people, etc. That's what I think.